Wearing contact lenses has never been easier. For many, they're just part of everyday life. And these days, nearly everyone can wear them virtually anytime, anywhere. Over the next few minutes, we'll show you how to insert and remove your lenses, as well as some cleaning methods. Getting started. Hygiene is really important. Common sense, really. Always wash, rinse, and in particular, dry your hands thoroughly before handling your lenses. Ideally, use a non-oily, non-scented antiseptic soap. Lens insertion. So now let's choose a place somewhere to put your lenses in. Ideally, you'll want a light, bright and clean environment, a flat surface and a mirror. Remove the lens from its packaging or case. It's good to get into the habit of doing the same eye first each time. Check the lens is not inside out. Gently bend the lens like this. If the edges touch, you're fine. If they don't, gently turn the lens inside out and try again. Place the lens on your first finger. You now have a choice. Here are two ways to insert your lenses. Your eye care practitioner will advise on the best method for you. Lens insertion method 1. Look up slightly. Pull your lower lid down with your middle finger. Gently place the lens underneath the coloured part of your eye. Slowly blink. The lens will settle into the correct position. Lens insertion method 2. Place one hand over your head and with your fingers pull the upper lid up whilst holding the eyelashes. Place the middle finger of the other hand on your lower lid. Look towards your nose and place the lens on the white of your eye. Again, close your eye and the lens will settle into position. To check that the lens is correctly placed, cover your other eye and your vision should have improved. If the lens irritates, take it out and clean it. We'll show you in a minute how to do this. And try again. Discomfort is normally caused by dust or small eyelashes underneath the lens. If after cleaning your eye is still irritated, remove the lens and consult your eye care practitioner. Your eye care practitioner will advise you about a suitable wearing schedule. Different lens types may be worn for different lengths of time. Wear the lens and go about your everyday life as normal. Time to remove the lens. Here are two methods. Again, your eye care practitioner will advise the best method for you. Lens removal, method 1. Make sure your hands are washed, rinsed and thoroughly dry. Look slightly up with your eye wide open. Pull the lower lid down with your middle finger. Place your forefinger onto the lower part of the lens and slide it down to the white of the eye. Slowly bring your thumb and forefinger together and gently fold the lens together without pinching it hard. Try not to touch the lens or your eye with your fingernails. Lens removal, method 2. Place one hand over your head and with your fingers pull the upper lid up whilst holding the eyelashes. Place the middle finger of the other hand onto the lower lid so that the eyelid is pulled down. Slowly turn your head whilst looking in the mirror and slide the lens with your first finger onto the white of your eye. With your finger and thumb, gently pinch the lens and remove it. Well, that's removing the lenses. If you're wearing daily disposables, throw them away. Otherwise, here are some techniques for cleaning. As a contact lens wearer, it's vital that you remember the importance of cleaning and caring for your lenses each time you wear them. Regular care will keep your contact lenses clean and comfortable and ensure your eyes stay healthy. Your eye care practitioner will recommend the solution that is best for your needs. Cleaning your lenses. There are two types of lens care, known as multi-purpose solutions and hydrogen peroxide solutions. Cleaning your lenses. Multi-purpose solutions. Aquify MPS is an example of a multi-purpose solution. Let's look at the steps you need to go through to clean your lenses. Always wash and dry your hands thoroughly before handling your lenses. Best to always start with the same eye to avoid confusion. Place your lens in the palm of your hand. Apply at least 3 drops of solution to each lens surface. Gently rub the lens, using a backward and forward motion, for at least 10 seconds each side. This removes daily buildup of oils and dirt. Rinse the lens thoroughly with solution while rubbing the lens gently between thumb and forefinger. Place the lens in the lens case and fill one side of the lens case to the index line with solution. Do the same with the other lens. The solution will now disinfect your lenses. Allow your lenses to soak for at least 5 minutes or longer if instructed to do so by your eye care practitioner. Your lenses are then ready to wear. Discard the solution from the lens case and rinse it with solution. Don't forget to replace the cap on the bottle and screw it closed. Next, let's take a look at hydrogen peroxide solutions. Here is an example called Aosept Plus. Wash and dry your hands. Then open the lens basket and place your contact lens on the dome. Close the basket, taking care to avoid trapping your lens. Then repeat the procedure with the other lens. The platinum disc looks like a cog. Fill the cup with Aosept Plus to the fill line. And place the lens holder in the cup and screw it closed. The solution begins to bubble. This means that the platinum disc is breaking down the active ingredients into oxygen and water, cleaning your lenses and leaving a gentle, preservative-free saline solution. Allow your lenses to soak for a minimum of 6 hours or overnight. Remove your lenses and they are now ready to wear. Discard the used solution. Here's a tip. If your lenses remain in solution for more than 7 days before wearing, you should repeat the procedure again. Using these techniques, you'll enjoy a trouble-free time with your lenses. Always remember, if in doubt, take them out and talk to your eye care practitioner. This Wearing and Caring for Contact Lenses program was brought to you by CivaVision.